Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Dr. Michael Caldwell, Director of the Metro Public Health Department, Dr. James Hildreth, President and CEO of Meharry Medical College, Grace Smith, Executive Director of the Council on Aging of Middle Tennessee, and Teresa Broyles-Applin, Executive Vice President and CFO at Nashville Electric Service. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department is here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. As I announced at yesterday's briefing, we will start phase 1 of the roadmap for reopening Nashville on Monday morning, May 11th. Nashville has performed the most widespread testing of any local government in the state of Tennessee, and our overall public health metrics give us a passing grade, and our residents are ready to safely return to work. Now, today we have a relatively small number of positive cases to report, even though we have averaged over 1,000 daily tests over the past several days. This is good news. But this news will also fluctuate. Remember, the beginning of phase 1 does not mean a complete return to business as usual. Rather, it is the next step in our coordinated response to the coronavirus, in which we shift from a broader strategy to a more targeted approach in safely living and working in the era of COVID-19. Now, as Dr. William Schaffner of Vanderbilt University mentioned, the decision to begin phase 1 has not been easy. Rather, it's been a balancing act of public health priorities and the pressing economic needs of our working families. 477,282 jobless claims have now been filed in Tennessee. And the best way to get people back to work is to stop the virus. Now, every COVID-19 related casualty is a tremendous loss for our community, but Nashville's hospitalization and mortality numbers remain relatively low. Throughout Davidson County, the rate at which the coronavirus disease is doubling remains flat, and we are fortunate not to have experienced dramatic spikes in cases that threaten our hospital capacity and other critical healthcare resources. Again, we do not have all the answers, and we certainly did not pretend to have them, but we will continue to look for the right answers together. And together is the operative word. More than ever, we're counting on all of you to practice safe social distancing and to follow all public health protocols. As our testing capacity continues to grow, we will see case numbers naturally increase. But your efforts will largely determine the sustained success of our economic restart. Your dedication to social distancing, wearing face coverings, and hand washing will largely determine whether we can move forward to phase 2 or whether we have to backtrack in the event of a spike in cases. Now, as we start phase 1, Metro Public Health and Metro Police will step up their enforcement of public health orders to protect our residents. And our epidemiologists will continue working with community partners to address clusters within Davidson County. Now, Dr. Michael Caldwell will provide more details on both of these efforts momentarily. Everyone has the right to be safe while participating in our local economy. And I urge everyone to patronize those businesses that have the best interests of their staff and customers at heart and demonstrate good faith by following public health protocols and best practices. These include compulsory screenings and face coverings for employees and both hand washing and social distancing reminders for customers. Metro's COVID-19 website features a toolkit to help educate all types of local businesses as they prepare to reopen, with guidance on sanitization procedures, employee health screenings, and public health measures intended to protect customers. You can also visit the toolkit to download and print a copy of signage reminding customers to wear face coverings at all times. You can access the toolkit for businesses today at covid.19.nashville.gov. Now, over the past several weeks, we've hosted roadmap webinars for restaurateurs and other small business owners and religious congregations, and has had nearly 1,200 attendees. Yesterday's webinar was specifically created to address the needs of our residents who are 65 years of age and older, addressing physical health, mental health, and important community resources for our older adults in Davidson County. As we've all seen, the coronavirus does not discriminate. Everyone is susceptible to the disease, regardless of age, race, or ethnicity. But older adults are disproportionately affected by the virus. Now, this morning, I'd like to welcome Grace Smith, Executive Director of the Council on Aging of Middle Tennessee, who's with us to discuss the effects of COVID-19 on residents 65 and older and the steps they can take to protect themselves and each other. This afternoon's Roadmap webinar is hosted in coordination with the Nashville Convention and Visitors Corporation and is designed for our local hospitality industry. And please visit Metro's COVID-19 website for more details. Remember, the Safer at Home order has been extended until the start of Phase 1 on Monday morning. And I urge everyone to continue remaining at home through the weekend and only leave your homes for essential purposes. Now, Metro Public Health has responded to 9,330 calls to our COVID-19 hotline. At our community assessment centers, we have performed 10,223 in-person assessments, and 9,314 of the 34,160 total COVID-19 tests conducted throughout Nashville have been conducted through the assessment centers. Tennessee currently ranks 9th in the country in tests performed per capita, with more than 227,000 total tests as of yesterday afternoon. And to date, the state has tested 3.29% of its population, and Davidson County has tested over 5% of our residents. We will continue to increase our testing capacity and offer COVID-19 tests at our community assessment centers at no charge to all Nashvillians. Now, if you think you have symptoms of COVID-19, please call 615-862-7777 from 7 a.m. to 7 p.m. And Metro's community assessment centers are open 5 days a week, Monday through Friday, from 9 a.m. to 3 p.m. to help support our phased reopening. Now, the Public Health Department distributed all 25,000 cloth face masks received from the state's COVID-19 Unified Command, and an additional shipment of 25,000 masks will arrive soon to help protect our residents as we begin Phase 1. Now, Metro Water Services reminds all Davidson County residents that because some buildings have been unoccupied or used less frequently in the recent weeks, interior water quality may have deteriorated and can pose a health risk. It is important to ensure your private water system, which begins at the meter, is safe to use after a prolonged shutdown. And please visit the Metro COVID-19 website for information on flushing your water system and performing other basic maintenance procedures before use. Now, NES crews have restored power to more than 129,000 residents who lost power over the last week. Approximately 2,000 residents remain without electricity as of this morning, and I want to welcome Teresa Broyles-Applin, Executive Vice President and CFO of Nashville Electric Service, who is here this morning to provide us with an update. And as always, it is a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who has joined us to provide his insight as an educator, community leader, and infectious disease expert on the coronavirus and our response to the disease. Remember to call 311 or visit hub.nashville.gov to request storm debris removal from the public's right-of-way. And finally, this morning, I'd like to express my appreciation to Amy Lankheit, Forrest Sponseller, and Eric Workman, who provided American Sign Language interpretation services at Metro's press briefings since the March 3rd tornado struck our community and throughout the coronavirus response. I want to thank them very much for their hard work. Now, Metro is committed to providing accurate, up-to-date information to all Nashvillians, especially during a time of crisis. And I'm thankful for our friends at the Bridges of the Deaf and Hard of Hearing for their ongoing partnership. Please visit Metro COVID-19 website, where you can contribute, as you are able, to the COVID-19 Response Fund, or learn how to obtain direct financial, food, mental health, and social service assistance. And I'd like to turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus, and also to wish everyone in Nashville this weekend a happy Mother's Day.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 3,460 confirmed cases and 35 fatalities. That's an increase of 28 cases over the last 24 hours. 1,615 of those cases are active, and 1,810 residents have recovered and have been cleared. Now today, as the mayor noted, the community assessment centers are open until 3 p.m. They're located at Nissan Stadium, Meharry Medical College, and at the old Kmart in Antioch. So far, this week alone, 2,201 residents have been tested at our centers. Beginning next week, I'm proud to say that Meharry Medical College will begin managing of these 3 centers. The city's healthcare partners came together to open the centers. I'm so grateful to each of these systems who, when their city needed them most, they stepped up and helped open these centers. St. Thomas Ascension, HCA TriStar, Vanderbilt University Medical Center, Nashville General, and Meharry Medical College. From the earliest days of this pandemic, their hard work expanded free testing to all of our residents. Nashville has set the standard and the pace for the state and the nation on providing free testing, and these partners are the reason why. They will continue to be a valuable partner to us as we open the city back up. We are also very appreciative of Meharry Medical College, who offered to manage and staff all 3 centers moving forward. In addition, Meharry will be launching a mobile testing team that can go to our cities, that can go to areas in our city and expand the reach of free testing. Now, this will be a really important part of our outreach plan to attack the virus in the hotspots of our city. And Dr. Michael Caldwell will speak further about the hotspot outreach plan later. Now, as we navigate the roadmap to reopening, the ability to react to these hotspots will be critical. We have the public health capacity infrastructure in place to attack these hotspots, and will continue to add additional resources as needed. Now, on Monday, we will be entering phase 1 of the reopening plan. Please don't expect things to be back to normal as they were back in February and early March. Phase 1 is a first step in the opening plan. It is not back to the way we were before the pandemic. It's a new normal. Most of what we are doing now will continue into phase 1. Stay at home as much as possible. Work from home whenever you can. If you're over 65 or have underlying medical conditions, be extra vigilant. Wear face coverings out in public. And please, no more gatherings of more than 10 people. Now, the big changes, however, in phase 1 are as follows. Dine-in services at restaurants and bars that serve food will be at 50% capacity. Retail and other commercial businesses will open up at 50% capacity as well. However, all employees must wear face masks, and all employees must be screened daily, including a temperature check and symptom review. For more details on the roadmap for reopening, please go to our website, covid19.nashville.gov. Now, we need your help. Wear your face covering in public, look out for your loved ones, and encourage others to do the same. And if you see businesses not employing safe measures, don't give them your business or your money. If you don't feel safe, don't go there. You are the best advocate for your own health and safety, as well as that of our neighborhoods. And I also would like to wish Happy Mother's Day to everyone out there. Very personally, as somebody, my wife has stepped up a great deal and has been a great support for my family. I know every mother right now, more than ever, has been. We truly are all in this together, and I know we'll get through this together. Now I'm happy to introduce Dr. Michael Caldwell, Director of Nashville Public Health. Thank you.
Thank you, Dr. Jahangir. I will cover our Hotspot outreach plan to contain current clusters and to prevent others from arising. I will also discuss enforcement of Phase 1. First, our Hotspot plan. Contact tracing to identify, investigate, isolate, and contain COVID-19 from spreading in our community is critical to containing and preventing new hotspots from arising. That's why the Metro Public Health Department has grown from a team of 4 people now to 75 today. This team is continuing to grow, and we have hired additional staff that will be trained and start next week to further enhance our ability to expand contact tracing efforts. The Health Department, working with our partners, Siloam Health and the Tennessee Immigrant and Refugee Rights Coalition, have hired a multicultural team that will start next week. This diverse team of COVID-specific community health workers will be part of a larger effort focusing on contact investigations and public health outreach to reach the various backgrounds and cultures within our community as we are moving to contain hotspots and respond quickly to preventing others from arising. As a complement to all of these efforts, I am also working with Lori Shinton, President and CEO of Hands On Nashville, on a new effort where we plan to deploy volunteer teams. These teams will promote education and hand out educational materials. These teams will also be able to assist us with a community assessment of compliance of our public health orders and guidelines for Phase 1 reopening, focusing on publicly accessible businesses, in addition to working within residential areas. Now, about enforcement. Nashville enters Phase 1 on Monday, and compliance of these requirements in the first phase will be important to keeping Nashville safe. We need everyone's help. If you are a Phase 1 retail establishment or restaurant, I recommend you use the helpful resources and tools available by visiting the covid19.nashville.gov website. There you'll find guidance, frequently asked questions, as well as informative webinars that should answer all of your questions. To our community members, I very much appreciate everyone who has followed the Safer at Home order. And I know you may feel ready to be out of your house and eat anywhere but home. But we are entering a new COVID world. If you visit a restaurant or any retail establishment and you see they are not following Phase 1 rules, such as being overcrowded or employees not wearing a facial covering, choose another restaurant or another establishment that is doing all they can to protect you. You can report a business that is not following the Phase 1 requirements by visiting the covid19.nashville.gov website or by calling 311. One of our teams, made up of Metro Public Health Department staff and Metro Nashville Police Department officers, will follow up. I thank the Metro Police Department and the Metro Parks Police for their help to enforce the Safer at Home order. We could not have responded to more than 500 complaints over the past month without you, and we appreciate your continued support. We will be hiring up to 20 additional environmental health investigators. This will complement our already existing team of 10 to assess and to assure compliance with our Phase 1 reopening. Finally, to businesses that don't follow the rules, you are putting the public's health at risk. And I can assure you that the Metro Public Health Department will use all of our available enforcement options to ensure compliance as we move into Phase 1. This will continue as we move along the roadmap to reopening our great city. I'd like to thank all of our dedicated Metro Public Health Department staff for all of their efforts in response to this pandemic. Each of us understand the importance of our role as public health professionals for the health and safety of everyone who lives, works, and plays in Nashville. Now, I'd like to introduce Dr. James Hildreth, the President and CEO of Meharry Medical College.
Good morning, Nashville. On January 21st of this year, the CDC confirmed the first COVID-19 case in this country. Today, 108 days later, there's 1.2 million cases that have been diagnosed, and 75,000 people have died. That's an average of 10,000 infections per day and 75 deaths per day. The major models that are used to predict the trajectory of the pandemic all agree on one thing. They disagree on a lot of things, but they all agree on one thing, that we've not reached our peak of infections in this country. But even if we have reached a peak, we got to go down the other side. And even if the rate of decline is twice as fast as going up, that means at least 2 million people will be infected and over 100,000 people will have died. And recently, we've all observed many, many people gathering in large groups, not socially distancing, not wearing masks. And there's a predictable outcome to this. There are going to be further outbreaks and further clusters of infections. And what that means is that whole communities may have to prolong their virus mitigation steps. The point is, we're going to be dealing with this virus for many months to come. There's a lot of talk about having a vaccine in a year or less. Let me say, as someone who studied viruses for 40 years, that's a really great thing to hope for, but it's not very likely to happen. Vaccines are very complicated, and it often takes a lot of time to understand which immune response is important. Antibodies are used to fight off the virus, and killer T cells are needed to kill the infected cells. And to be quite honest, we don't quite know yet which of these two responses are most important for eliminating COVID-19. I'm convinced that we're going to set a record for a vaccine in this case, but the shortest time on record is 6 years for Ebola. So I think we all need to get used to the fact that we're going to be dealing with this virus for 18 months or longer. So what does that mean? That means that next week when we enter into phase 1 and ease back into a new normal, all of us need to be vigilant and keep doing those things that we've done to keep our community safe. We need to keep wearing our face coverings, washing our hands frequently, and doing all the other things that we've learned to keep ourselves and those that we love safe. Sunday is a very special day. It's Mother's Day, and many of us are going to be tempted to go visit our moms, give them a hug, a kiss, take them to brunch. Let me just say that's the worst possible thing some of us could do for our mothers. What we need to do, the best possible gift to give them, is to keep them protected from COVID-19. Because we know, especially if they're older than 65, their chances of getting really sick and possibly dying from the virus are actually very high. So Nashville, we got this. The state has done a great job of controlling the virus. And I want to say a special thank you to our governor. Governor Lee has done two things that deserve special thanks and acknowledgement. The governor has made it possible for anyone in the state who wants to be tested. And as I've said before, the only way to fight an invisible enemy is to make them visible. And that's what testing will do. The second thing that the governor has done is to make it possible for every nursing home in the state and every prison in the state to have the residents and staff and incarcerated persons evaluated. These two things are going to save hundreds of lives. And as far as I'm concerned, it should be the model for the whole nation. Every single state should do what the governor has done. And by doing that, the number of people who will die will be substantially less. So I'd like to offer the governor, our governor, thanks and kudos for what he's done, and ask all the other states to consider doing the same. Tennessee is outstanding in the number of tests that it's doing. I'm also proud to be a part of the assessment system in the city, where we've done a great job, I think, of providing tests for those who need them. But Nashville, there's still work to do. And as we reopen the economy, as you heard Dr. Jahangir say, we need to be vigilant. And if you're not comfortable in an establishment that they've done all they can do to protect you and the people who work there, my advice is to go to another place, right? And if we do those things, we can move on to the next phase. But if we don't do those things, we'll find ourselves back where we started. So in Nashville, we got this. And by all means, remember, don't be a vector. So with that, I'd like to introduce Grace Smith, the Executive Director of the Council on Aging.
Thank you, Dr. Hildreth. I want to start by expressing my appreciation to Mayor Cooper and our public health officials for closely monitoring the COVID-19 situation and creating a careful and targeted reopening plan with continued physical distancing, screenings, and masks. As one writer said, we are not all in the same boat, but we're in the same storm. And we'll get through this together by heeding the advice of our public officials and helping each other. We know that older adults have a much higher risk of serious illness and death from this virus, so it's vital that we do everything possible to prioritize the health and well-being of our older family members, neighbors, congregation members, and friends, especially those in nursing homes, assisted living, and congregate living communities. If you're over 65 or you're caring for someone over 65, it's vital that you do everything possible to protect yourself by continuing to stay home as much as possible, using a mask when you have to go out, and practicing good hand hygiene. These are things we all need to do, but they are especially critical if you are 65 or older. Now, I know this news is discouraging when we've had to stay home nearly 2 months, and we're hearing that this may go on for another 18 months. It's hard if you're used to working and you need to work, if you miss volunteering or going to a community or fitness center or getting your hair done. It's especially hard if you live alone and don't have access to technology or the internet. Yet I know we can and we must adapt to this new reality and find ways to stay physically active and connected while we continue social distancing. Whether it's taking walks outside, gardening, talking on the phone, using FaceTime or other video meetings, or back porch visits, staying 6 feet apart. We can find ways to take care of ourselves and stay connected with others. We're fortunate in Nashville to have so many caring volunteers and organizations that are helping right now, with friendly phone calls, food and meal delivery, telehealth, video counseling, and other vital services. Please know that you are not alone and help is available. You can call United Way at 211 or the Council on Aging helpline at 615-353-4235, and we'll help connect you with services and support in the community. We will get through this together. And now I'd like to introduce Teresa Broyles-Applin with NES.
Thank you, and good morning. On behalf of Nashville Electric Service, I'd like to thank Mayor Cooper and his team for their ongoing support as we've continued to work through power restoration for our customers throughout our service territory. While we've made tremendous strides since Sunday when storms caused power outages for nearly 132,000 of our customers, we're still working around the clock to restore power to those who remain without it. This morning, power has been restored to 129,000 customers. While we're proud of accomplishing so much in less than 5 days, our focus is on the approximately 2,000 customers that are still without power. We understand that it's very difficult to live without power for several days, especially in the midst of the COVID-19 Safer at Home order. That's why our crews will not stop working until every one of our customers' lights are on. Thank you for your patience, and know that we are working as quickly as we can to restore your power. We've repaired all major circuits and have now entered the phase of restoration process that focuses primarily on smaller outages impacting 100 customers or less. Crews are also in the process of replacing more than 250 poles that were destroyed by the storm. If you are without service and using a generator to provide temporary power, please follow safety guidelines. Do not operate a generator inside, and please do not connect a generator to a home electrical system, as this poses serious safety risks to you and our crews. Yesterday, we announced that we are extending our grace period for non-payment. We will continue to not disconnect customers for non-payment and will waive late fees until June 30th in order to support customers who've been financially impacted by COVID-19. For more information, please visit our website and click on COVID-19 update or call our customer relations line at 615-736-6900. Please know that we are here for you and we want to hear from you if you need us. We're in this together and we'll all get through this as a community. Thank you.
Thank you, Ms. Broyles-Applin. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. Let's start with Nancy Amons at WSMV. Nancy?
Thank you very much. Some restaurants I know are concerned about opening at half capacity, saying it's not going to be lucrative for them. Would you rather them wait until they can open at full capacity, and is that wise? And also, I'd like to ask the mayor, what impact did the opening of surrounding counties have on his decision to start phase one? What weight did the mayor give that in his decision to pick this particular date? Thank you.
Thank you. Mayor Cooper?
Well, your two questions, half is better than none for restaurants. I appreciate their own difficult business choices, but the need to have smaller crowds is paramount. Also, the ability to give people the opportunity to practice social distancing going forward in order to operate safely. This is part of a gentle reintroduction back to the economy. We're not all going to get it right all the time, but I can appreciate venues feeling that you're going to need a certain load in order to be successful, and that is, of course, that's their own individual business decision. So in terms of the surrounding counties, we are not an island. You can't be inconsistent with your overall policy. However, our phase one reopening in the states are remarkably similar in many ways. And bars, crowds, social distancing are all confirmed with that. And then just our own data is based on our data. And then again, look at today, it's very good. The last several days on average have been very good. We have met the metrics for this county. And unfortunately, we have the same metric that our surrounding counties do also in terms of unemployment files claimed. And we have to be responsive to that number too. And we cannot, at some point, we do have to get back to work. The data justifies us moving ahead now. And frankly, let's just be clear. There will probably be an uptick in cases with phase one as we learn how to socially distance ourselves. We should be prepared for that, and if it is too great, we can go back. If it is too great, we have to go back. That's why there's a special shout out to everybody to start doing it right and to keep themselves and their families safe, and that's the best way of getting the economy restarted, is not to have an interruption going back.
Thank you, Nancy. Jeremy Finley at WSMV. Jeremy?
Good morning. Thanks again for taking all of our questions. I have two questions. One of them has to do with enforcement. I wanted to see if starting Monday, Metro Police will be doing roaming patrols, or public health will be doing roaming patrols looking for violations, or will you only be responding to complaints? That's my first question. My second question has to do with antibody testing. The FDA has now approved 8 tests that are approved for antibody testing. And so my question is, and I think this is for Dr. Caldwell, has Metro Public Health now planning to do antibody testing? And if not, what are the reasons why not? Thanks.
Thank you, Jeremy. Dr. Caldwell.
Well, as for enforcement, we're going to continue doing what we are already encouraging people to do, which is go to the Hub Nashville on your smartphone, or the covid19.nashville.gov website, and you could learn more about the order, or submit a complaint. So yes, we'll be responding to complaints, but we really want to use this phase to educate people. That's why we're working with Hands on Nashville and others to assess compliance, assure that that sign requirement is done, that people are wearing their masks. So it'll be a measured, phased-in enforcement effort, but it will be very proactive, and we want everyone's help to report any facility that's not responding. And you yourself, please choose not to go to those places, choose to go to other places. And I think that will sort of help us to self-enforce and rapidly get to the point where we're all complying. Now, for antibody tests, I find these to be a scientific curiosity right now. I think we'll probably learn more after 6 months. But antibody tests are not going to help keep us safe. Antibody tests are not going to help us with our continued reopening. Right now, the testing we're doing is what's going to help us to be safe and to do our reopening. There are many antibody tests, even the ones that are approved by the FDA, still have a lot to learn about that. If I test positive for an antibody, I don't know at what level may be protective. If we even knew at what level that antibody could be protective, will it be protective 2 or 3 weeks from now? Or, it's same with the vaccine moving forward. So we have a lot to learn, and we'll continue to learn more. Thank you.
Julia Palazzo at WKRN. Julia?
Good morning, everyone. Thank you. Dr. Caldwell, if I can pick your brain on enforcement real quick again. You mentioned all available enforcement options will be used if businesses don't comply. Can you further elaborate on what those options are? Like, is it a 3-strike system? Will there be fines involved? And then second question for Dr. Jahangir, the state's announcement regarding testing in public housing, can you talk about the importance of that and how that's going to work in Nashville? And also, if you have an update on the testing in long-term care facilities that we talked about a couple weeks ago. Thank you.
Thank you. We'll start with Dr. Caldwell.
We're going to be approaching compliance the way we do all the time. It starts with education, information, and most times, almost all times, we are greeted by managers who want to know what is correct and will immediately comply. So it's information, and then we'll go back to make sure that they are doing what they said. And if we find they don't, then it'll be a warning, and then we will go back again. So anytime we get a complaint and we see compliance, we will be back. Also, we are also doing, not just during regular business hours, we're doing off hours as well. So we need everybody's help, but it will be staged, measured compliance. Now, even after that, if they, after the warning, do not listen to us, there are a number of actions we could take. There's fining, as well as whatever permits they may have, depending on the type of facility they are, they will jeopardize those permits. And we don't want it to get to that level. So, thank you.
Regarding the housing test that state announced, a week or two ago, they contacted our office, and in fact, right now, 9:30, there's a planning meeting going on as we speak about how that's going to be executed. I believe the tentative date to start those testings is the 14th and 15th. I think that's a Thursday, Friday of next week. So that is in the works, and it's a pretty extensive plan that the state is running. I believe they're going to use the National Guard to do a lot of the testing, but we, as the cities, are very involved as well about the test and obviously the follow-up and so forth. Regarding long-term care facilities, one of the great things about partnering with Meharry Medical College is now we have a team, in addition to already what we had in our resources, to really do more of these strategic testing at these locations. We're finalizing those plans. I don't have enough information to share with you, but as Dr. Hildreth pointed out, these are important things to do for our city, for our state, for our nation. And I'm really proud, again, Nashville and Tennessee are leading that. And so more to come on that second part. And the first part, I hope, unless obviously a planning meeting, something changes today, but hopefully late next week, they'll start doing those testings. Thank you.
Harriet Wallace at Fox 17.
Good morning, everyone. I've got a few questions. My first is for Dr. Hildreth. I saw your tweet about the mask that people asking you about the mask. My question is, can you just give your analysis of the masks that were provided by the state and passed out at the health department? Because my understanding is that those masks are porous. So are those effective in protecting from the virus? My second question is for someone from the health department or for Mayor Cooper. We got the masks yesterday and we're waiting on more. However, they were not given in priority areas such as the hotspots or even to essential workers. Why is that, especially knowing that the city is going to reopen Monday and they'll need them? And my last question is for NES. We know that a lot of the poles are aged. There are some sturdier metal poles that are being installed. What is the plan to eventually replace those across our area, not just when the storm destroys them? Thank you.
Dr. Hildreth.
I was specifically asked to comment about masks made out of socks. And I pointed out that the masks that are made for professionals for PPE, the porosity is measured in microns or fractions of microns. But depending on what the mask is designed to do, a sock mask may be appropriate. For example, if you're going to try to prevent the exchange of saliva and not aerosols. So depending on what the mask is made to do or meant to do, different materials are appropriate. The other thing to keep in mind is that materials can be treated so that they become electrostatic. And if they're electrostatically treated, that can actually adhere and grab particles really well. So I don't know what the masks were intended to do. My answer was to the question of whether or not those masks would be effective as the mask used for professionals for PPE. And the answer is the effectiveness is determined by the porosity or size of the pores, and in professional masks is microns. And if you can actually see through the material, it may not be the best thing to use for the purposes of preventing exchange of aerosols.
Harriet, good morning. Regarding the distribution, I think, so we received 25,000. The public health department did an excellent job of quickly getting that out. Used our 3 public health facilities to do that. And Davidson County, I was on a call with the leaders of state and Commissioner Ezell, who's helping distribute it. And we're the one county where this distributed, our entire stock was used up, and they recognize that and are providing more to us very quickly. The great thing is the governor is committed for every Tennessean to get one. So as they're building these, we're getting the stock. Now, what that means is there will be another shipment, I think within the next week, and even a larger shipment subsequently to that. And so to your point of hotspots, essential workers, we're devising a plan. I spoke with several people yesterday to get that into our community. So while yesterday I think was a superb idea to get this out in our public health department, perhaps the next shipment will be done more at a council district level or a hotspot level. I'm not going to commit to anything right now, but to tell you, I think your statement is a very valid one, and we're working on developing a plan. We just wanted to get our first shipment out as quickly as possible. So more to come on that again. Thank you.
Thank you for your question regarding poles. With regard to poles, all of our poles are engineered to withstand winds of up to 90 miles per hour. And whether they're wood poles or metal poles, that's the case. We do have some wood poles on our system that are older than others. We do routine inspections of those poles, and those poles are treated to help them last longer. But if there is a need for replacement, we do have an amount we include in the budget every year for pole replacements. And a determination of whether a wood pole goes there or a metal pole goes there, there are a variety of factors, and an engineer is involved in designing what type of pole will be used for which circumstances. So I can't say that we have a lot of really old wooden poles that we're going through and replacing with metal poles. They may very well be replaced with other wood poles for those specific situations based on the engineering. Thank you.
Our last question this morning is from Caress Jackman at WSMV. Caress?
Yes. Good morning. I have two questions. A viewer reached out to us about a question concerning seniors. He works at a retail store, and they're reopening on June 1st. So my question is, what are the guidelines as to when employees who are seniors in particular should be expected to return back to work, or what would you recommend for seniors who are nervous about going back to work as we begin this reopening process? And then my second question, maybe it's for Dr. Caldwell. We're starting to see doctors across the country take a closer look at the multi-system inflammatory syndrome in children. I know there are some reports that it is treatable, but there are cases emerging across the country, and they're also trying to determine if it's somewhat related to COVID-19. Is this something that you're monitoring closely as well? Thank you so much.
Thank you. We'll start with Dr. Jahangir.
You know, your question around seniors is such an important one. This virus disproportionately impacts our elderly as well as our most medically vulnerable. And so, unfortunately, that's the reality of this virus. And until there's a vaccine, that risk is present and will continue to be. Now, for my suggestion is listen, yes, it's easy to say everyone stay at home if you're, meet that criteria and stay at home for 2 years. But in reality, we know that that's really not feasible. So here's my suggestion is speak with your employer. See if there's a way you can make accommodations. Perhaps you could, if you're in a cubicle area, you could be in a more secure office. Maybe you can stagger your time that you come to work, say that when you're riding up an elevator, it could be, maybe you're the only one in the elevator. Maybe have a way that you can work at home more often than not. We all have to be flexible here, employees and employers, but this virus is most impactful on our elderly and most medically vulnerable, and that's not going to change. So it's a fair concern. I just please be extra cautious. Thank you. And Dr. Caldwell.
Like you, I have been reading with great interest and great concern the newly emerging information about inflammatory processes with children and COVID-19. We are certainly going to be monitoring all symptoms through our contact investigation team. But I want to use this as a reminder that we still have more to learn about this COVID-19, this coronavirus, and that we are all at risk. So it's as important as our elderly to keep safer at home and to practice social distancing and to wear masks, as well as our entire families, because we may learn more about this, and we will learn more about this in the weeks to months to come. So please be safe. Please practice social distancing, wear a mask, wash your hands, use hand sanitizer. I need you to remember all of us are at risk. Thank you.
Thank you, everyone. I'd especially like to thank Dr. Michael Caldwell, Dr. James Hildreth, Ms. Grace Smith, and Ms. Teresa Broyles-Applin for participating in today's press briefing. Broadcast COVID-19 press briefings will resume on Monday, May 11th at 9:30 in the morning. You can visit covid19.nashville.gov to stay up to date on Metro's coronavirus response at any time. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.